Dr. Bayo. I am excited to join everyone. We are going to talk about weight loss drugs today. I am looking forward to hearing your questions, highlighting any concerns, anything that you would like to know more about. I'm excited to be here and hopefully answer a lot of questions. As people join, I just want to give a little background of who I am. So my name is Dr. Bayo Winchell, which is a long name. So I go by Dr. Bayo. I'm a family medicine urgent care physician who's also a medical director for the urgent cares and a medical director for a team for sexual assault. And it's work that I am so grateful to be a part of and to advocate and help. And when we talk about advocacy, my passion and love is health equity and health literacy. And I do that by sharing health information in hopes of empowering individuals across the country so you know more about your health, so you can advocate for yourself each time you seek care. So that's a little bit of a flavor of who I am, my mission, and why I do what I do. And so today we are going to, and I'd like to welcome whoever has joined. Thank you so much for joining the show. So today we are going to talk about weight loss medication. So they are all the rage right now. There are so many different options out there. I can't dismiss or discount the diet and exercise, but also there's a lot of medications. There's a lot of options out there, and it can be very difficult to know which option is best for you or no options. And that part is important to me. So I want to start with why we decided to do this topic. This all started with a patient that I saw that presented and shared with me. She came in and she was like, I started this weight loss medication a couple of months ago, but I haven't noticed any differences, any changes. And so we took a look, and she shared with me where she had purchased this medication from. We did a little bit of digging in, and there were some red flags there that just didn't really add up. She had shared that she entered a couple of pieces of information and then they sent this medication to her. Well, as we were navigating this medication and navigating the manufacturer, the organization that she purchased it from, through all of that, we found out that the medication that she was taking wasn't even a weight loss medication. So I did a little video. If you want to check it out, it's on Instagram. It's also on TikTok. And it's titled Red Flags to Know About GLP-1 or Weight Loss Drugs. And I share a little bit of her story of what happened in that space in hopes of elevating and amplifying all of the information that is important for you to know if you decide that you would like to try one of these drugs. So we discovered that she was not on that. And let's delve into a little bit of some of the red flags that I identified. One, they offered this medication at a very low price, lower than what you normally hear the traditional drugs, whether I'm saying Ozempic, whether I'm saying Manjaro, all of these medications, Zepbound, all of those. And they offered it at a very low price. It was less than what you would typically see. And I'm dancing around, so I'm not pinpointing because I don't want to pinpoint a certain group or anything like that. So that was a red flag because you have to you wonder, how are they able to share this same medication that is normally at a higher cost range of $800, $1,000. Sometimes people have shared they're even at $2,000. So that was one of the big red flags. The other red flag was she had shared that they only asked about 3 questions: her name, and she had to put her birth date in there, and then she, also gave a history of if she'd had any surgeries, but that was it. They didn't ask her any history of any diagnosis, which for me as a physician, it's really important that I know what conditions you've been diagnosed with, because when you have those certain conditions, that can either reinforce or support or make me think of another option for medications or other things that might be a better fit. And they did not ask any of those questions. And they didn't ask if she was allergic to anything as well. And that was another big red flag. And you can imagine where if you might be allergic to something and that could be in that product, we have an issue. So those were some of the red flags. I'm going to pause there and just see if there are any questions. I don't see any, but I just wanted to take that minute. And if anyone has just joined, I want to take the time to reintroduce myself first and just say thank you for taking the time to join me today. We're talking about weight loss drugs and the red flags to know, specifically the G1P1. I'm a family medicine doctor. I practice. That part is very important to highlight. I travel across the world. I get to share health information, but I also practice, and I'll never stop doing that because I truly love being able to see people and help people. So we're talking about weight loss medication. So there's so many out there, and it can be really hard to know. And for me, I've always been the type of physician where I do not subscribe to pushing only medications. For me, it's really about what is important to you. What would you like for your health journey? And that is not a one size fits all. That is not a specific body size, a specific food that you must eat, or a specific exercise regimen that you must adhere to. For me, it's your health. What can I do just to support it? And most importantly, give you all of the information. And that for me is also naturopathic. And I practice that as well. So I am the type of physician who welcomes different types, different ideas, different questions, different alternatives when it comes to weight loss medication. So we have many out there. We just kind of talked about some of the red flags. One thing that I share in my video, if you check it out, GLP red flags to know, I talk about a celebrity who unfortunately had an experience that can happen with these medications, which is where your stomach or your colon gets obstructed. And when that happens, the common symptoms that are associated are feeling nausea, stomach pain, bloated. Now, this can just happen naturally from those medications. But a red flag that I identified with my patient, and this is something I wanted to share, if you're not connected with a clinician who can really monitor and where you can actually contact them and say, hey, this has been going on for a certain amount of days, or my nausea or bloating really seems to be getting worse. She didn't have that connection with anyone that prescribed this medication from this company. And when you don't have that, you are not able to kind of maybe possibly identify those warning signs that may be present and respond to those, or the warning signs that may be, oh, this is a common condition. And so when we talk about obstruction of the colon, like I mentioned, when you have an obstruction, those symptoms are common, but they're also common when you take a weight loss medication. But if it progresses, if it gets worse, if you have other symptoms, it's really vital that you are seen in the emergency room or reached out, or that you reach out to your primary care doctor or someone that can really assess and see what is happening. So that paints a little bit more. Now, it's important that I have seen these medications work very well with a lot of my patients and with their loved ones. So again, my hope is to just share the information so you can make the best decision for you or whatever you would like, because it's not my health journey, it's your health journey. And I believe that I'm just here to hopefully help support. And I've had patients who have lost a significant amount of weight on these medications, and it's really been a life changer for them. I've also had patients where they've started the medication, and unfortunately, insurance has stopped approving them, which can also be a really big challenge to navigate. So I'm interested if anyone else has had that experience. If you have, feel free to drop that in the chat. And also feel free to ask any questions. I love questions, I welcome them. It's something in my practice where if you come and you have a question, I will honor it. And if anything, I want that. I want you to be able to come in and share. So we talked about a couple of the red flags. Again, I'll reintroduce because I don't know if new people have jumped in. I'm Dr. Bayo Winchell. I am a family medicine physician and a nationally recognized health advocate. Health advocacy and health literacy are my jam, my love. Really being able to share health information in a way that helps people get the best care whenever they seek care. And I talk about a wide variety of topics. So today we're talking about weight loss medications and what to know. Now, we can't forget the importance of diet and exercise. So when we talk about these medicines or medications, sometimes it can be thought as if this can be like the fix, this is it. I just do the injection or I take this pill and I will lose weight, and there's no other factors that need to be a part of it. And I think it's not often discussed or brought up that it really is a wraparound with any weight loss journey. It's the mind, body, and soul that must be in sync to really be able to, number one, sustain that weight loss, to achieve that weight loss, to achieve whatever you're looking for. Everything has to be in alignment because without it, you're not really able to honor all the systems of the body. And we know that the mind is a powerful, it's so powerful. And it's very important that mentally that you're in the right frame of mind when we talk about these medications. And a good example is I remember back in the day, I've been a doc since 2012, where some of my patients who had decided to do weight loss surgery and they did it, but unfortunately, 6 months, a year, 2 years after, they ended up gaining the weight back and actually gained even more weight than before. And I think that is a great example of how important that our mind is a part of this journey, that our mind is really a part of whatever health journey we take, because if we're not there mentally, and we may not still make the best practices as far as what foods we choose, what we exercise, and those, and protein intake as well is key, so we can't forget that, and lifestyle changes, because there isn't a one size, there isn't a magic key. All of those factors have to be a part of it. So that's a lot of information, and I'm going to pause and just see if anybody wants to drop anything in the chat. And you don't even have to ask a question. You could also just tell me where you're coming from, where you're listening, or where you're tuning in from. That's a better way to say it. I'm in Nevada, so I'm on the West Coast. It's 1:45 here my time, and I'm sure a lot of you may be Midwest, East Coast. So please let me know where you're listening from, because I always love to hear that information. So, okay, we're going to talk about more. So I've given a couple of red flags. I'm going to recap those, and then I'll talk about a couple more. So one, I talked about a red flag when we talk about weight loss medications can be if the price point is very low, and it's possible that it's that they're able to sell it, but you really want to dig in and just make sure, how are they able to deliver this medication or offer this medication at a lower price than anybody else? You have to think and wonder, are they cutting any corners? Are they doing anything of that? And sometimes these companies are sourcing these medications from other countries, which Not saying that that's a bad thing, but really making sure, do you know where this medication's coming from? Do you believe in the manufacturer that's supplying it? Have there been any reviews that are negative or positive about these companies? Because that helps you really know more about what medication you might choose to take. And we can't forget, whatever we put in our body, it's there, it can affect all of our organs, it can affect every part, and it can even impact your ability to do your daily activities or go to work tomorrow. If you ingest something that isn't what you think it is, it could really turn your life upside down. So that, investigate I think investigation into what you're taking is a powerful and an important piece. So we talked about price point, that's a big one, making sure. We also talked about health history. Do they ask, what are you allergic to? Do they ask, what conditions have you been diagnosed with? Because those are things, as a clinician, as a physician, are very important with your health history. And then the other red flag we talked about is, are you tied into somebody that can really closely watch your symptoms to make sure that if you have nausea, if you have any of those factors, is it normal? Is it something we need to kind of look into? Is it something we need to either back off of the medication? And this is often not discussed as well. So although the medications normally have this kind of, you're going to have 1 milligram, 2 milligrams, 3 milligrams, we all don't fit that regimen. So I've had patients who I've actually had to back off a little bit and just give them less, or a micro amount versus the traditional. And having someone that you can reach out to and say, "Hey doc, I'm feeling really bad on this," because you shouldn't feel bad like this. You might feel uncomfortable and or nauseated and so forth, but if it's been weeks and you do not feel well, you should not you really should reach out to someone. So looking at, what is the right dose for you is very important. Because again, I've had patients where I've had to titrate down or titrate up. And you want to make sure that it's the right dose for you. Now, I'm going to tie in, I had mentioned the celebrity. In my video, I talk about Macy Gray. And I talk about how she unfortunately she was hospitalized due to symptoms. And unfortunately, these symptoms are very common. And one of the biggest symptom that I see in my practice for patients who have started these medications are constipation. And it is like a constipation no other. I'm just going to put it out there like that. Um, I'm sure everybody listening has experienced constipation, and it's terrible. You feel like pun on words, you do not feel well. So I'll just put that out there. Well, this is a whole nother level of constipation. And I recommend, of course, a lot of water just in general, but water before, and also stool softeners are vital. And potentially some patients have had to be on laxatives or different products just to kind of move things through. You can also use different fruits, cherries, what else? Prunes, all of those things in combination can also be helpful. And I actually have my patients start it before they start this medication versus waiting for the constipation to start and then trying to respond. I am a big believer in preventative care versus responding to illness and disease. I love to really put effort and invest in what can I do to keep you healthy in hopes of preventing these diseases. Because for me, the ultimate goal is not for you to be on a medication. The ultimate goal is for you to thrive and do whatever you would like for your health. And that includes all areas of medicine. And it doesn't have to be medications. It can be different essential oils. It can be herbs. It can be foods that are just bright in color, bright in nutrients, bright in protein. All of those things that are important, and it shouldn't have to be in a bottle to necessarily be the right fit. So I'm excited that I got to come on and talk about weight loss medications, and just really thankful to blackdoctor.org to highlight this topic. And hopefully, I have shared information that will help you make the best decision for yourself, your friend, your family, or a loved one. Because in the end, and I mentioned this before, as a physician, I am so grateful to be a part of people's lives. And for me, it's about being on your health journey. For me, it's about what is important to you. And I just get to come along and get to share all the information. And then I listen, I acknowledge, and then I honor whatever health topic, whatever decision making that you would like to do, that's what it's about. Because that's why I became a doctor, to help people. And that's what it's all about. So I am grateful and thankful to have to join today. And I always end every show with a lens and a level of gratitude. So thank you all for your time, your energy. I appreciate it. And check out the video. Check out my handle on Instagram. All my information is free. It's all written by me. It's all put out there in hopes of helping as many people as I possibly can. It's just been an honor to be a physician and try to help and touch lives everywhere. So you can check out my handle at dr.bio on Instagram. I'm on TikTok, YouTube. I'm also on LinkedIn. Feel free to reach out. I've got a lot of videos out there that are free, engaging, and hopefully help you with whatever health journey that you may be facing. So thank you to everyone. And I'm going to close here. Thank you.